Imagine your parent cutting their toenails. They may have done it for years. But did you know this simple task can become risky? Diabetes can lead to serious foot issues. Small cuts can escalate, causing infections. Today we'll discuss 7 mistakes to avoid when cutting toenails. We'll also cover warning signs to watch for. Plus, I'll give you a 60-second foot check routine. Stay with us to learn how to protect your loved one's feet. Diabetes affects everyone differently. Every foot care routine must be tailored. Always consult a healthcare professional. Diabetes can damage nerves in the feet. This condition is called neuropathy. A person might not feel injuries or blisters. Combined with reduced blood flow, healing becomes harder. For example, if your dad accidentally cuts his skin, he may not notice. Weeks later, that cut can become infected. Proper foot care is essential and requires attention. Now let's go through common toenail cutting mistakes. First, cutting nails rounded at the corners is wrong. Instead, toenails should be trimmed straight across. This prevents ingrown nails and skin injuries. Second, avoid cutting nails when vision is poor. If your parent cannot see their nails well enough, help them. Offer to have a professional do it instead. Third, don't cut nails if your parent can't feel them. Neuropathy can lead to lack of sensation. Always consult a healthcare provider if they experience tingling or numbness. Next, never try to fix thick or yellow nails at home. They might require professional attention. Strong tools won't solve the underlying issues. Fifth, don't dig at ingrown toenails. This can cause infections. It's essential to have a professional handle this situation. Also, be wary of assuming if it doesn't hurt, it's fine. Nerve damage means injuries may go unnoticed. Check their feet regularly for signs of problems. Lastly, always inspect the feet after cutting nails. Look for cuts or swelling and don't ignore changes. Early detection is key. If your parent can trim their toes, remember this. Always wash and dry their feet first. Cut straight across and smooth with a non-sharp file. When in doubt, seek professional help. Now onto the 60-second foot check. Help your parent check their feet regularly. Look on top and bottom. Check between toes and around nails. Ensure everything looks normal. Daily foot checks can catch small problems before they escalate. If bending down is hard, use a mirror for assistance. In closing, if your parent has diabetes, assist them with their foot care. This isn't about scaring them, it's about preserving their independence. Want your parent to continue enjoying life? Share this video with them. Comment below. Did you know diabetes affects foot care? Subscribe to Strong Past 70 for helpful tips on keeping older adults healthy and active. Because when it comes to diabetes, tiny issues can lead to bigger problems. Imagine the weight of responsibility resting on your shoulders. As you prepare to assist your parent with their foot care, you realize that this is more than just a routine. It's a crucial step in preserving their quality of life. You take a moment to gather your thoughts, determined to approach each tip with care and compassion. With each cut of the toenail, you are not just helping, but also ensuring that their freedom and health remain intact. As you sit down with your parent, you gently remind them how vital it is to maintain proper foot care, especially with diabetes. You stress the importance of being proactive. It's about catching potential problems before they become serious. You pull out a mirror to make checking their feet easier, emphasizing that small, daily routines can make all the difference. Together, you start the foot check by looking closely at the skin's condition, ensuring their feet are habitually examined for any signs of pain or discomfort. Now that you've established a routine, you guide them through the process with patience. Let's start by checking the soles, you say softly, as you both lean forward, eyes focused, ready to identify any unusual changes. You demonstrate how to gently lift each foot, making sure to inspect the heel and arch thoroughly, reinforcing that open communication about any discomfort is essential. As you work together, you bring attention to the importance of a clean environment. It's crucial to have everything ready, you explain, ensuring that tools are sanitized and within reach. You watch as your parent nods, absorbing your words. Mentioning the proper way to trim nails, you clarify, always cut straight across and never too short. This helps avoid painful issues like ingrown toenails. You can sense their understanding, and it feels rewarding to equip them with knowledge that may prevent future complications. As the foot check continues, you remind your parent, "Now let's take a close look between your toes. This area often gets overlooked and can hide problems." You carefully point out how moisture can accumulate there, leading to potential infections. "Make sure to dry thoroughly after washing," you advise gently, reinforcing the significance of maintaining overall foot hygiene. As you shift your focus to the nails, you explain, "Now let's assess the toenails themselves. Look for any signs of discoloration or unusual thickness." You gently swipe your finger over their nails, encouraging them to feel for any bumps or irregularities. "Early detection here can prevent bigger issues down the road," you remind them, placing emphasis on the need to remain vigilant. Adjusting the mirror for better visibility, you continue, "If you notice any thick or yellow nails, remember, don't attempt to fix them at home. It's always better to consult a professional." You see the understanding in their eyes, a testament to the importance of these conversations. Continuing the foot check, you gently remind your parent, "Now let's check for any cracks or calluses on the heels and balls of your feet." You take your time, explaining how these areas can often become dry and require moisturizing. Keeping the skin soft helps prevent painful fissures that can lead to infections, you emphasize. As they listen attentively, you add, "If you notice any thickened skin, let's address it with your healthcare provider." This dialogue not only builds their confidence, but strengthens your bond, with the mutual goal of ensuring their health and well-being. As you wrap up the foot check, you softly remind your parent, "Remember, daily inspections can catch issues before they escalate." You feel a sense of accomplishment, knowing that with each shared tip, you empower them to take control of their foot care. By embracing these practices, you help ensure that your parents' independence and well-being are preserved, allowing them to continue enjoying life without the worry of foot-related complications. Together, let's make everyday foot care a priority. Remember, a little attention goes a long way in preventing bigger problems down the line.